The obesity epidemic, 6 common health risks. Did you know that obesity is now considered an epidemic in the United States? Hello to all my subscribers and anyone who is new to this channel. I am Dr. Parker, and please continue to watch the video to hear from Fit and Wellness Over 50 about the obesity epidemic and the 6 common health risks. According to the Center for Disease Control and Prevention, more than 1/3 of American adults are obese. This means they are at a higher risk of developing heart disease, stroke, type 2 diabetes, and other serious health conditions. In this video, we will discuss the causes of obesity and some of the health risks associated with it. We will also provide tips on losing weight safely and effectively. What is obesity? Obesity is a medical condition in which excess body fat has accumulated to the extent that it may have an adverse effect on health, leading to reduced life expectancy and or increased health problems. In Western countries, obesity is often seen as unattractive and is commonly associated with various negative stereotypes. There are several different ways to measure obesity. The most common method is calculating the body mass index, which measures weight in relation to height. BMI values outside of the normal range are considered indicative of overweight or obese status. Another way to assess obesity is by measuring waist circumferences, as this can provide an indication of abdominal fat storage, which are more strongly linked to health risks than fat that is stored elsewhere in the body. A waist circumference of about 40 inches in men and about 35 inches in women is generally considered to be indicative of abdominal obesity. Obesity is a major public health problem in many developed countries, with rates increasing dramatically over the past few decades. In the United States, for example, the prevalence of obesity has more than doubled since 1980, rising from 15 to 35% in adults, with similar increases seen in other developed countries such as Australia, Canada, and the United Kingdom. What are the causes of obesity? The causes of obesity are complex and multifactorial, but typically involves an energy imbalance between consumption and expenditure. Energy intake can be influenced by many factors, including the palatability of food, social factors such as peer pressure, and marketing. Meanwhile, energy expenditure is determined by one's basal metabolic rate, the number of calories required to maintain basic body functions and physical activity level. While there are many potential causes of obesity, the most common culprit is simply consuming more calories than you burn. This energy imbalance can be due to a combination of factors, including eating high-calorie foods, leading a sedentary lifestyle, and having an underlying medical condition that affects your metabolism. In some cases, obesity can also be genetic. If you're struggling with obesity, it's important to seek help from a medical professional. They can assess your individual situation and recommend a treatment plan. Obesity is a serious condition that can lead to many health complications, so don't hesitate to get the help you need. The risks associated with obesity. There are many risks associated with obesity. The risks are greater with the more obese you are, and they also depend on where the excess fat is stored in your body. Abdominal obesity, carrying that excess weight around your waist, is more strongly linked to health risks than fat stored in any other body, such as the hips and your thighs. The 6 common health risks associated with obesity include: number 1, an increased risk of developing type 2 diabetes. Number 2, an increased risk of developing cardiovascular disease. Number 3, an increased risk of developing certain types of cancer, such as breast cancer and colon cancer. Number 4, an increased risk of suffering from sleep apnea. 5, an increased risk of joint problems, such as osteoarthritis. 6, an increased risk of infertility. Obesity is a serious problem that can have a profound effect on your health. Many resources are available online and in your community to help you reach a healthy weight. Obesity is preventable, so take actions today to protect your health and improve your quality of life. Prevention of obesity. You can prevent obesity by eating healthy foods and increasing your exercise regularly. You should also avoid sugary drinks, fast foods, and processed snacks. Instead, focus on eating whole food and high in fiber and protein. Additionally, make sure to get at least 30 minutes of exercise each day. This could be anything from going for a walk or to playing sports. Following these simple tips can prevent obesity and live a healthier life. What are the types of weight loss surgeries for people that are obese? There are 4 major types of weight loss surgery, which includes gastric bypass, sleeve gastrostomy, duodenal switch, and adjustable gastric banding. Gastric bypass is the most common type of weight loss surgery performed in the United States. It involves creating a small stomach pouch to restrict food intake and rerouting the small intestine to bypass the majority of the stomach. Sleeve gastrostomy is another common type of weight loss surgery. It involves removing a large portion of the stomach, which reduces hunger and the amount of food that can be eaten. Duodenal switch is a more complicated type of weight loss surgery involving restricting food intakes and malabsorption. It is not as common as the other types of surgery, but it carries a higher risk of complications. Adjustable gastric banding is the least invasive type of weight loss surgery. It involves placing a band around the stomach to create a small pouch and restrict the food intake. The band can be adjusted to allow more or less food into the stomach, depending on the patient's weight loss goals. Weight loss surgery is a serious decision that should not be taken lightly. If you are considering weight loss surgery, ask your doctor about all the risks and potential complications. Weight loss surgery is not a quick fix, and it is not for everyone. But for those who are committed to making a lifestyle change, weight loss surgery can be a tool to help them reach their goals. Conclusion: obesity is a complex health issue that requires the combined efforts of individuals, their families, their communities, and the governments to prevent and manage it. To date, there is no one-size-fits-all solution to obesity. However, by understanding the causes of obesity and taking actions to promote healthy eating and physical activity, we can make progress in addressing this public health challenge. If you or someone you know is struggling with obesity, please seek medical help. Together, we can beat this epidemic and improve the health of everyone in our communities. Also, if you find the video to be informative, please give us a thumbs up and click the subscribe button so you can be notified weekly of more informative videos. Thank you for watching.